Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic Posture Movement Clinic. This has to do with tension up here, tension between shoulder blades, pain in the shoulder joint. So very, very, very important move that we all did as babies. So stay tuned. All right, so one of the things that I see quite a bit has to do with a lot of tension with the neck, upper back, shoulder joint. We really don't utilize our muscles properly. So what I'm inviting you to do is to go back to what you once did, and I promise you, you did. In fact, all babies on this planet, with a few exceptions of genetic disorders, I'm sure, have gone through this. This is when we practice assigning the muscles in the arms to do their job, the muscles in the shoulder blade area that stabilize it to do their job, and learn to work with the front, while the stabilizers, this rectangular shape body part, stabilizes you. So we're learning to have the stabilizers stabilize while the extremities do their job. So in order to do that, you're going to be laying down on your back. Once again, there are a whole bunch of videos that are prelude to this. So we're going to make sure that we at least put one or two of them here. And this is what we did when we were, 5 months old. So we're going to be going into this position, which, like I said, there's an actual system to it. So this is a 3-month position. Your whole spine is on the floor, so your back is not arched. Your lower ab is engaged. Everything is there. Your legs are up in the air, supporting themselves. Your arms are up in the air. Your scapula, you're not reaching. Your shoulder blade is not lifted. So one arm is here, and the whole thing has to be on the floor. So your shoulder is not lifted up. Your neck is not like that. Those are typically what we end up in the office with. So we're going to engage the oblique muscles to rotate the tabletop. So it's going to be like this, and I'm going to stop here for a second. I'm going to start. Let me finish this first because it's hard to talk. So I use my oblique muscles to rotate me. My butt muscles and my leg muscles are on this top leg are just basically lifting this up, so it's not a dead weight. So it's lifting it up, so I'm not compressing the bottom joint. I'm not using these muscles to arch back. This side of my muscles, my body, and this side are working together to elevate me so my hand can go slide there. So once again, it's not arched up. My neck is gliding back. My arm is rotated and stretched, so it's not loosey-goosey like that. It's nice and stretched, and I'm putting life in these muscles like that. And I hold it, and when it's time to go back, I'm gonna bend. I'm still allowing these muscles to be lifting me up or help lifting me up in this area. Press down here, and I'm not letting my legs to bring me back here. I'm making my oblique muscles to carry me as soon as I bring this up. Just like that. Huge, huge help, because you have to understand, if your torso does not stabilize the torso, if the corners of the torso are being in their place because of the lower and upper extremities, then when the lower and upper extremities have to do their job, the stability fails. So your brain's gonna be all about, well, geez, how am I gonna hold this up? So whatever is God is gonna come in to hold you up. This is where the dysfunction happens. So this is what you did when you were 5 months old. I promise you, you can do it again. It looks very easy. It looks very simple, and yet you'll see how challenging it will be. If you have any questions, make sure you contact me using one of the methods of contact in the description box. Subscribe to my YouTube channel and check out the website. It's all about knowledge and empowerment. Until next time, take care.